training them, briefing and processing of our responders to avoid burnout or stress. Next. The international partnership that is, I think, the most significant. It's with Living Works Australia. It's the world's leading suicide intervention program trainer. No, they went here weeks, actually 1 week bago ng lockdown. Pumunta sila dito. They trained us. They trained the responders, and unfortunately, magkakaroon na sana kami ng international certification as a trainer. Kasi ang trainers yata nila, isang taga Hong Kong, isang Indonesia, yun pa lang sa Asia. So hopefully, bayad na po natin yan. Makapunta kami when the restrictions are lifted so that we can get certification and we can train people, more Filipinos here in the Philippines, more frontline workers. Next. Ito rin some of the pictures, no? Next. Yan. Evidence lang. Next. As far as external collaboration, local, we started talks 2019 with the different mental health groups, professional groups, Philippine Guidance and Counseling Association, Psychological Association of the Philippines, and the academe, the UST Graduate School Psychotrauma Clinic. Why? We wanted to establish a network of collaboration. Bakit? For referral purposes, for capacitation ng aming responders, at for responding. Mamaya explain ko po yun. Next. Ano po ba yung naririnig na telemental health response? Originally, this is a, next slide, originally intended for frontline workers and repatriated Filipinos. No? Ang idea noon, kasi nung dumadami, nung initial time ng COVID, marami pong mga frontliners yung affected by the pandemic and the repatriate. So it was a virtual platform ng parang teleconsultation pero more on mental health. Ang problema, hindi sila masyadong makatawag kasi mga nasa quarantine area, walang internet facility. So what we did was nakipag-partner kami noon with the PGC. Ito talaga yung first real collaboration namin. At yung mga nirefer sa amin from the hotline papunta dun sa telemental, tinignan nila. Okay? Intervention was given from the hotline. Next. So ito lang yun, telemental, to provide psychosocial support. Next. We'd like to thank the DOH, the CUEVAS. They were the ones who provided us with desktop, computers. Kompleto po yun ang ginagamit namin up to now. Next. So ito yung flow. Nagtulong ang NCMH Wellness and Crisis Center, PGCA volunteers, from the referral sa hotline, tinitignan po ang mga kliyente. Next. So ito po yung flow. Next. Ito po yung ito yung binigay ng binigyan din kami pala ng laptops. So thank you very much CUEVAS DOH for the continued support. Next. And ito yung sinasabi ko na very important statistic namin na yung mga from the hotline, na-stabilize sila, okay. Pag na-stabilize sila but we feel na kailangan pa nila ng next level or additional time to talk, punta sila dun sa telemental, kinakausap sila, at makikita po dyan na marami po ang naseservisyohan, hindi na nila kailangan pumunta sa mga psychologists, psychiatrists para magbayad. Libre po yan. Now, dun po sa mga kailangan ng gamot, again, collaboration, through dun sa dating program po na in-spearhead ng previous administration, yung e-consultasyon sa outpatient naman po yun. Pero meron pa rin po kaming nire-refer outside kasi hindi naman po natin kaya lahat sa NCMH. Next. I think this is also a very significant event, yung regional meeting as October 10 or 20, 2020. Hindi ko malala kung 10 or 20. And I think some of the regions are here na the initiation of that meeting opened the doors for further collaboration. Nalaman namin nila mga presi na marami pa palang hotlines available nationwide. And in that meeting, all major regions were represented. At kasi ako nun, bakit ang baba sa ibang regions? Yun pala, meron na rin sila. Not just a crisis line, but providing psychosocial support for COVID, etc. We had preliminary talks with the private hotlines. Medyo naputo lang, but that's something that we're going to work on in the pipeline in the next few months. Next. So ito yung picture nung October meeting natin. Nalaman namin ang dami palang hotlines available sa mga regions natin. Next. And through that meeting, lumabas, ito pala, maraming numbers na pwedeng tawagan. Next. So, ito yung significant development, no? We are currently finalizing a memorandum of agreement, understanding na tanong, with PGCA and PAP for level 3. Sabi ko nga kanina, di ba? We are partnering with them for 3 reasons. Number 1, to get the official directory. Kasi may mga tumatawag sa hotline, kailangan ng counselors, kailangan ng psychologists. You want it to be official, number 1. Para official and alam naming licensed yun. Number 2, para po magkaroon kami ng feedback mechanism and for data gathering, sino yung na-refer namin. Number 2, capacitation. Nagsimula na po ang UST, inunahan ko na, ang psychotrauma clinic. Apart from the assist, apart from the continuous training namin ng responders, kasama po yung UST ngayon. Nag-start na yung training. A lot of topics, workshops, capacitate not just our responders, but more of the mental health workers here in NCMH, the training office, the nurses, and of course, our psychological section. Ano yung level 3? Marami po kasi sa mga tumatawag, stabilize mo, na-stabilize pero kailangan sa elemental. Pag na-stabilize, good, okay na siya. Pero marami po sa kanila, kailangan talaga ng therapy. Hindi po namin binibigay yon. Paulit-ulit ko po sinasabi. We are not giving counseling yung responders ko. They are just doing crisis intervention. Yung level 3, 1 registered guidance counselor, 1 clinical psychologist, still working on visa, 8 to 10 per counselor or psychologist per month ang titignan niya. And we're looking at 5 na RGC, 1 clinical psychologist. So ilan yung matitignan for free? They will become consultants of our on a contractual basis. Ito po yung nakikita kong pinakamagandang mangyayari itong taon na to. Next. Ito pa. Hopefully, ma-lift ang restrictions na makapunta kami ng Australia to get the certificate. We can capacitate as many people in the Philippines in suicide prevention. Ito po yung aming patapos na. Systems improvement through PPLDT. Again, salamat po sa DOH for the funding. Sila po ang nagbigay sa amin nito. Parang magiging call center based na po ang ating hotline. Mare-review ang calls, monitoring, evaluation, and for data gathering. A nationwide toll-free system. Nakausap na po namin ng PLDT, Smart, and Globe. Dinadahan-dahan lang namin ng Presi kasi baka mabigla tayo pag biglang naging toll-free, ma-flat ang calls natin. So, give us a little more time, yung system nandiyan na. Siguro 1 to 2 weeks, magta-turnover na ang PLDT sa amin. Pero we will do it slowly para hindi ma-flood yung ng callers yung ating hotline. Next. Collaboration with more government agencies. Medyo mahirap ito. Yung DLLG 911, ilang beses na po kami nag-meet. Burnout na rin sila. Di ba Ma'am Presi, alam, dun sa ating wellness in the workplace. Nag-iiyak na nga yung mga responders ng 911 kasi sila yung tumatanggap ng mga tawag. But we are slowly working on that together with the DSWD and other LGUs in crisis responding. Ang aming dream po is for our training manual to be evaluated and to be used to set up more hotlines. The more the better. The more the merrier. And of course, we would like to connect with the different mental health facilities, especially in times of suicide crisis referral system. Next. So, gamitin ko lang din yung slide na yan, di ba, guys? Ito po yung numbers natin, but hopefully by the end of the year, isa na lang yan. Lahat doon tatawag. But we will keep the other numbers just in case. So, yun lang po, handang makinig. Pag may problema, kamusta ka? Tara, usap tayo. Next. Yun na yata yun. Salamat po and ayun, maraming salamat and good afternoon to everyone. Morning pa pala. Morning to everyone.
Maraming salamat po, Dr. Bernard, for giving the updates on the NCMH hotlines. So na-flag niyo po or na-mention niyo po sa inyong discussion na tumaas po ang numbers ng suicide-related callers. Pero reassuring din po na sa NCMH, continuous po yung capacitation na ating responders. And ini-ensure po natin na timely po yung referral to our psychiatrist. And sa ways forwards po natin, na-mention po natin na yung NCMH 24/7 crisis hotline will also be toll-free and for the next segment po of this town hall, we have Dr. 𝙤𝙤𝙤𝙤𝙤. She'll be discussing the youth initiatives in advancing mental health in the community. She's a practicing medical doctor specializing in occupational medicine and is a graduate of UST. She herself is a breast cancer survivor for almost 4 years now and is currently the Philippine leader for Livestrong Foundation and the National Advisor of the Youth for Mental Health Coalition. She was a previous project consultant to the WHO Western Pacific Regional Office, and she is currently the head of Makati Medical Center's Wellness Center. She's a staunch mental health advocate and life and leadership blogger, and has launched a project called Padayon Philippines, which aims to serve as a mental health resource hub, hoping that more people will gain access to. Good morning, Dr. Gia. The floor is now yours.
Hello, Nikki, and magandang umaga sa lahat. Maraming salamat, Ma'am Presi, Doc Bernard, for explaining yung ating mental health law at yung mga initiatives po. Bago ko po simulan yung short topic ko po, kasi I was tasked to discuss about yung advancing mental health amidst the pandemic and more of youth-led organizations po. Hats off po ako sa mga CSOs natin who have actually stepped up and really walk the talk of practicing mental health advocacy. So I'm here to present po some of the great initiatives po na na-encounter ko. So as the National Advisor of Youth for Mental Health Coalition. So dun sa RA 11036, malakas po yung pillar ng awareness in terms of mental health. And starting the pandemic or even pre-pandemic, madami na pong clamor in terms of sa webinar, podcast, isa po mga platforms po ito na pwede natin pasukin to be able to further the education regarding mental health, infographics, and spaces. No? So the usual topics po na rine-request ng private companies, schools, is usually about self-care and mental health 101. Coping with online classes, they have hindi ko masasabi na paulit-ulit itong topic na to because it will always be needed and it's a dynamic topic to be talked about. Andyan rin po yung coping with stress and burnout, dealing with family concerns. So there's a family component po, managing anxiety and depression, and of course, the topic of self-harm and suicide. That's why po, Doc Bernard, maraming salamat po sa NCMH and the way you have been developing the hotline. Alam ko po, jam-pack po yung line, but still po may mga sumasagot. Maraming salamat po, Doc. Next slide. Now, magawi tayo sa online support groups. Now, these are on-ground activities na nangyayari po. Kasi nga po, lahat po tayo ay nasa computer po. And support groups for now may not be possible because nga of how the pandemic is. But so we make use of the platforms of online. So nandiyan yung peer support, yung mga one-on-one support, kasama na po yung nagkaroon po yan ng project Hilom. Up to now rin po yan, but it's actually timed. No? Project Hilom is, the aim is to create support groups among students, no? Youth leaders, young workers, including yung mga SKs natin. Kasi 17 sessions, ito naman po sa ating mga families sa LGBTQ community as a support group. Because when we talk about mental health, we have to address all its aspects po. Now, these are support groups and capacity building sessions for people of diverse SOGI. So from every now and then po, ina-announce po ito sa Facebook page ng Youth for Mental Health Coalition. Next slide. And napag-uusapan po natin yung promoting mental health sa community setting, no? Nakita naman po natin yung pyramid na present ni Ma'am Presi. So some initiatives were initiated by the Caloocan Young Leaders. They trained young people po in psychosocial support to address their community. Tapos nandiyan rin po yung Sandigan Sandalan Training and Advocacy Program for Mental Health. This is naman a project conducted by the UP system to train. Dito po parang nag-appoint sila ng mga mental health focal persons in all universities po. And then they hold webinars, they hold online support groups as well. And of course, it's very noteworthy to say that because of the pandemic, private companies, huge as that, has been working on their own mental health policy in the workplace. Isa po yan sa component ng RA 11036. And we have been heavily involved in the development of its policy and training as well of employees, although on our own capacity on handling mental health concerns. Of course, kasama po dito yung referral system sa ating mga guidance counselors, psychologists, and psychiatrists. Next slide. So this is a noteworthy training done by the Youth for Mental Health Coalition. Nag-conduct po sila ng mental health navigators training. Now, ang output po nito is to be able to build more systems of support kasi yan po yung kulang natin eh. So ang output is they have trained sangguniang kabataang officials for mental health services. So nasimulan na po yan at nandito po yung founder ng Youth for Mental Health Coalition na si Dr. 𝙤𝙤𝙤𝙤. Next slide. And of course, hindi po mawawala yung facilitating service delivery. So again, I will mention the initiatives of Y4MH in terms of Project Tulay. Kasi during the pandemic, nagkaroon ng challenge in terms of medication support and delivery for those economically disadvantaged. So nagkaroon po ng project na ganon para, of course, this is with prescription, ma-deliver yung medication sa mga people with lived experiences po. And of course, there are volunteer support professional groups na mention po to ni Doc Bernard about telemental health services. And a directory as well of services, no? A list where pwedeng i-type sa browser at lalabas po dyan yung mga CSOs who have really volunteered their services. No? Next slide, please. This is a personal project po na ginawa ko po last year dahil po sabi ko sa sarili ko, why not make a web page or a website where people can actually access and serve as a repository para siyang deposit box ng mga mental health service network po. So yan po yung storya ng Padayon PH. So ano po yan? Meron po siyang certain column rin po if you wanna be a volunteer, but of course volunteers have to be guidance counselors and they are trained. And meron rin pong part dyan na unsaid feelings part, where people can just type how they feel. Kasi hindi naman po lahat nakakapag-access agad. So meron po siyang isang part doon na pwede nilang i-type yung kanilang nararamdaman para lang po mag-vent out. No? That forms part of coping. Most especially nowadays na mahirap po talaga, and I think mental health goes hand in hand, not only with the COVID pandemic. Next slide. So in terms of dealing with mental health for the youth, kailangan po i-address the whole spectrum of mental health, no? Depression, anxiety, and of course yung mga subgroups noon. We always have to emphasize on community building, no? Lagi po namin yan sinasabi sa mga webinars, education, awareness campaigns that aside from the lectures we give, it is our wish na ang output ton is to build more. No? Parang train the trainers po yan. To complement existing services po. Number 4, to contextualize the language according to the needs of the youth kasi iba-iba po yan. And lastly, it should involve the youth in all stages. Kasi iba-iba rin po yung mga needs ng mga yan para po makapag-build tayo ng mga programa na ayon sa mga youth po natin. I think that's the last of my slide po. Maraming salamat po sa opportunity na to. And good morning.
Maraming salamat po, Dr. Gia, for the things that you have mentioned with regard to the trainings for promoting mental health in community settings. We'll now open the floor for questions po. We have a few questions po actually from the CHO Davao, Ms. PRESCILLA Senok. Yung questions po na to our panel, will there be trainings related to mental health, and how can we concretize the ways forward presented here? I believe the questions can be answered by Ma'am Presi as well as by Dr. Bernard. Ma'am Presi, you can go first, please.
Yeah, concretizing, no? It's not enough kasi yung 10 minutes, even when nagsumobra pa nga ako, kaya ako nagmamadali kanina. It's a lot of things to pack into a 10-minute presentation. But anyway, yeah, one of the very tangible, I think na output na kailangan nating magawa with the implementation of the Mental Health Act is the establishment of a community-based mental health program in the country. Kasi ito talaga yung core, no, ng deliver the mental health services in the country. If we have a community-based mental health program in all of the communities, no, the local government units or geographical areas across the country, providing mental health services at the level of the community themselves. And nakita nyo naman kanina yung presentation, Dr. SISON, no? There's a lot that the community themselves are able to do. Hindi naman sila run talaga by health professionals. No? So if we are going to have that, and we are working on it, we have a project that's ongoing, no? And tinitest out namin yung mga different elements that we'll have to put in place. Basic, organic, generic elements that each community probably should have. Then ano bang dapat, and then the training or the capacity building that we need to put in place, particularly to the community, to the health workers in the area, because as we all know, very limited po talaga yung mga mental health professionals natin. So kailangan natin silang i-train yung tayo mismo, yung hindi mga professionals. And we have, because each and every one of us, and I think that has to be on our mindset, can become a mental health provider. So yun po yung isang pinaka-tangible, and we are already doing that. As of the moment then, we're training actually our local government units sa primary care level, no, na talagang at their level ng mga doctors doon, ng mga primary care doctors. They are not specialists, they are general doctors, generalist. Yung mga primary care workers, doctors who are there at the communities. We are training them on diagnosing and assessing mental health conditions, common mental health conditions. And then we are also hopefully going to be providing at least adequate amount of drugs and of medicines, no, medications, because we know that if we provide medicines to our patients, of course hindi lang po ito yung pwede natin maibigay sa kanila, no, but the most tangible kasi ngayon, may marami na po tayong mga pasyente na nangangailangan talaga ng gamot. So that's the reason why we're providing providing support in terms of medications for mentally ill patients. Para po pag may mga gamot na sila, at least, no, they can go back to the society, they can be reintegrated, and so on and so forth. So marami po tayong ginagawa. Ito po yung sistema na inaayos po natin sa ngayon. And yan po yung that's the ways forward. All the other things that we are working on, of course, are developing a lot of guidelines para po yung mga tao naman who are supposed to be doing it are trained. So meron po tayong training. No? If you are a health worker, local government unit, then you are going to be trained on MHGAP and other types of training for mental health interventions. So that there are trainings already available. And I'm sure Dr. Argamosa also have some training programs that are available.
Maraming salamat po, Ma'am Presi. Dr. Bernard, would you like to add to that?
Yes, nabanggit na lahat ni Ma'am Presi. But I think we have to go back really to the basics. We capacitate people with the basic information training. Psychological first aid. Now, number one, very important yan. It can be taught to everybody regardless of your status. Pwedeng-pwede yan. Kasi yung pakikipag-usap mo sa isang tao na may problema, hindi man kailangang psychiatrist ka or psychologist ka kaagad. Basta may alam ka sa psychological first aid at alam mo na at sasama namin yung suicide first aid education, malaking bagay na po yun. As I've said, collaboration. Kung na-train ka sa PFA, sa processing, sa suicide first aid, nakakita ka, uy, kailangan ito ng next level. Pupunta ka ngayon sa health center. Kasi tinrain na siya ni Ma'am Presi sa MHGAP. Dahil nakita siya nung doktor doon, kailangan mo ng gamot, may map, bibigyan ka. Okay? Ngayon, kung may problema, parang complicated pa, tatawag ngayon si RHU or si health unit dito sa amin kasi ang community-based mental health coordinator namin si Dr. 𝙁𝙤𝙤𝙤𝙤 for mentoring. Sila magtuturo, sila magme-mentor. So, anong mangyayari dito? Hindi na sila pupunta sa ospital. 'Di ba? Nahuli na natin sila eh. Let's remember, ang mental health, once you catch it at the earliest phase, the faster that they can go back to their functionality. Pag hinintay mo yan, na nagkaroon na ng breakdown, pahirapan na yan. So, I think, yun lang medyo problematic yung pandemic. But siguro, pag medyo nag-subside na, we can do it Zoom naman eh, yung PFA training. Ang problema na yung Presi, the suicide first aid education training that we give na certified kami ng Living Works, ayaw nilang pumayag na hindi face-to-face. Yun yung problema namin. But tingnan ko na lang, we're inaayos namin sa kanila na huwag maging masyadong rigid, pero sumusunod na kami sa kanila. Pero pwede nating paikutin ng konti para pabigay natin. Iyan natin sa local setting.
Thank you po, Dr. Bernard. Salamat po. Meron din po tayong mga comments po from Facebook. From a company program to employees, how can we be able to reach out to our speakers for them to be invited po? No? So, madami po sa mga nanonood sa atin right now interested din po to conduct the same workplace. My question din po here for Dr. Ghia. Dr. Ghia, how can our CHDs move forward in establishing mental health initiatives within their jurisdiction? How can they avail of capacity building activities, especially for HEPO's point of view? Dr. Ghia.
I'll take it off from yung sinabi ni Ma'am Presi and Doc Bernard of the opportunities to train for mental health first aid dahil may clamor po talaga doon. So you can start from within po and tap on resource speakers lalo na sa PPA, sa guidance counselors. You can start with that kasi everything naman starts with awareness and then you train others also. So ganun yung that will always be part of building a community. We start from awareness and then we move forward. Tapos, meron rin ang DOH ng tulong alalay gabay for community. So you might want to tap into that as well. Maraming salamat.
Yeah, thank you, Dr. Ghia, for saying that because I wanted to say it earlier. Nakalimutan ko lang. Yung
yes,
tulong alalay gabay really is for the community.
Yes, po.
Mga nanay, mga kapatid, yung tampay.
Opo, totoo po yan.
Yeah, they need to know that because it's just a very easy, not a very easy thing, but it's what we can all do. Tulong alalay gabay. And
Yes,
it's
po, ma'am.
already online na. Naka-online na kami. It's an online platform. It's going to be, pinapilot pa lang. Kasi every time na mag-online kami, papiloted. So, but it's already an online thing. We're trying to finish the piloting pa lang. And it will be available for everyone, hopefully.
Doon na yan, Ma'am Pres. Looking forward.
Yeah. Thank you.
Maraming salamat po to our speakers. For the next question po, how can the CHDs encourage the public or the people to join these kinds of initiatives? To all of our panel po, perhaps we can start with Ma'am Presi again, ma'am. Go ahead po.
CHDs, they're asking. Okay. Well, I would just would like to say this. The regional coordinators or the CHD coordinators namin for mental health are very active. Napaka-aktibo naman talaga ng mga regional coordinators. Actually, kung minsan baliktad mga nangyayari, they have more practices that they do. They go beyond what the central office is actually doing because they know their own specific areas. They know their own specific needs. So mayroon pong mga leeway sila to do things. They can modify, they can innovate, and even conceptualize new things. Basta within naman sa program policies po natin. So how can we encourage them? How can they encourage people? Just continue siguro to do advocacy activities. Parang ganun din po nangyayari sa atin dito. And I think I believe that the first step really is to inform people. So pag binigla mo kasi sila na talagang may serbisyo na pag hindi pa nila naiintindihan kung ano yun, parang mental health pa rin is still a very ticklish topic for so many people. So I think we need to really all go out information dissemination. What is mental health? Ano ba ito? And to really, make sure na stigmatization is lower down. Well, it's a big word and it's not just so easy to say na maglo-lower down siya talaga. Kahit nga among the mental health professionals, that's what we stigma. We stigmatize our own selves also. But having said that, I think there's a lot of ways we can see.
Thank you, Dr. Ma'am Priscilla. Dr. Bernard, go ahead po if you have anything to add on how we can
Nasabi na
encourage.
ni Ma'am Presi, no? So, again, I think siguro let's introduce mental health advocacy campaign among the health workers sa mga LGUs in the context of caring for them, caring for the carers.
Yeah.
Kasi baka pagod na rin sila. Kaya when you introduce, yun yung experience namin sa MHGAP nung post-Yolanda. Parang ang unang dating sa kanila, nagtrabaho na naman ito. Hawak ko na itong programa, hawak ko na ito, kaliwat kanan. So maybe we can introduce mental health in the sense na, ano tayo, mental health, this is for you, for you to be able to ventilate, or let's talk about you as healthcare workers. Pag nakita nila na, ay, ang ganda pala nito, gawin natin ito sa labas. So let's motivate first people within the mental health community, government, and then makakalabas na tayo. Medyo mahaba pa. But we're getting there. We're just in the infancy, toddler na ba, phase of the mental health law. So we are going to get there. Malapit na, but it's going to take some time, process, and a lot of hard work.
Yeah, I just would like to say this after, itong sinabi ko nga kanina, after years of probably and decades of, ito may neglect, hindi naman na talaga natin pinag-uusapan ng mental health even before, ngayon lang. I think we're still trying, to engage a lot of people. Kaya let's just do what we can do and be patient. We're really moving forward, but you have to make sure that when we move forward, we have the proper mindset, and we have, we can establish the systems. Kasi kung bara-bara na naman yung paggawa natin ng mga bagay-bagay, hindi naman siya sustainable. So we just it should be like systematic systems. We put the systems in place, guidelines, standards, frameworks, para kahit na mag-retire na si Presi, nandiyan pa rin ang lahat.
Thank you po, Ma'am Priscilla. Dr. J, there's a question here po. If you can give a few pointers po on how people can cope with the pandemic.
Okay, one tip is to be self-aware of how you feel. No? Kasi that's one thing na importante lalo na nowadays na kunyari may nararamdaman ka, wag i-brush off. You have to be aware. Self-awareness is really key, no? Number 2, diversify yung activities natin. Kasi minsan, of course, lahat tayo is may restriction sa mga ginagawa natin. So makakatulong kung yung mga aktibidad is also diversified. No? You can learn something new, etc. And of course, lastly, I cannot underestimate the power of support. So madaming mga support groups na nandyan. No? So make use of them because they are there for a reason. And yun, self-care pa rin. Kung makikita naman natin sa pyramid, even dun sa WHO service pyramid, self-care is the basis of all. So yun, yun yung take ko dyan. Thank you, Nikki.
Maraming salamat po, Dr. J. Those are practical tips po for our fellow countrymen on how to combat mental health. Meron po ba tayong gustong i-add to these pointers, Ma'am Presi or Dr. Bernard? Go ahead, Dr.
I just would like to say na tama pa si Dr. Gia. I think self-care really is very important. We should know, we should really take care of ourselves first because we cannot take care of others kung may sarili tayong problema. I think that's a given in any emergency. Unahin mo muna yung safety before you can, save others also. And the second thing is that one of the health promotion natin sa ngayon for mental health actually sa 7 healthy habits is take care of yourself and taking care of others. Kasi when we take care of ourselves, that's a sign that we are mentally healthy, and when we take care of others, that's also a sign. But if we neglect that, if we don't do that anymore, if we cannot even take care of ourselves, then baka po may mga issues na po tayo. So I think that's a very important idea that we need to, and concept, that we need to put forward.
Thank you, Ma'am Francis. Dr. Bernard?
Ay, sorry, ano ulit yan?
If you have any...
Nagugutom na siguro ako. Hinihintay ko yung pa-lunch mo eh. Joke.
Dr. Bernard, if you have any pointers po on how people can cope with the pandemic.
Ang daming beses nang tinanong sa akin yan. Let's hope for the best, but prepare pa rin for sa akin pa rin prayer. Hindi po ako masyadong religious, pero in all the disasters, in each and every crisis event, ang lagi ko pong nakikitang nagpapalakas ng resilience ng tao is spirituality. Even the PPA, even the psychiatric organization and psychological organizations have recognized the need for spirituality at this point. Hindi natin alam kung how long ang pandemic, may darating na naman, diba? Hindi natin alam. Let's continue praying, hope for the best, prepare for the worst, and collaborate, partnership. Napatunayan po namin yan sa crisis line. Ang daming problema, di ba, Ma'am Presi, nung initial months, hindi ako nakakatulog. Pero now, marami pa rin problema, but because of the collaboration, because of the partnership, hindi po kaya ito ng isang organization. We need to work as a whole, or private, government. Sabi sa Universal Healthcare Law, di ba? One Philippines, one mental health. Yun po.
Maraming salamat po, Dr. Bernard. I believe those are all the questions we have for today. To finally wrap this up, Under Secretary 𝙔𝙤𝙤𝙤𝙤, ma'am, meron po ba kayong payo din po sa ating mga kababayan na nakaka-experience ng mental health as well as your closing remarks po? Thank you, Sec.
Yes, thank you, Nick. Bago ko tapusin, before I close this town hall, I just like to say thank you, of course, to Miss Presi Cuevas, our Chief Health Program Officer, our Program Manager for Mental Health, also Dr. Bernard Argamosa from the National Center for Mental Health, and Dr. 𝙤𝙤𝙤𝙤𝙤, our National Advisor ng Youth for Mental Health Coalition. Maraming salamat po sa inyo. I know that work has been very difficult, especially when pandemic started. And alam ko po ang dami nating challenges, especially because of the pandemic, that our services have lost yun pong access na tinatawag natin, and people had to grapple so that they can be able to reach our services. But luckily, we were able to gradually implement, no, especially these hotlines, which were very, very important for our citizens. Nakita niyo po lahat kanina yung ating mga statistics that we really had this increase in uptake for these services. Dahil alam naman po natin na marami sa ating mga kababayan ang nangailangan ng ganitong at nangangailangan pa rin ng ganitong mga serbisyo galing po sa ating gobyerno. We saw 40 or 200% increase from the previous 2019 calls for this NCMH hotline. And what we are doing right now is finding funds, collaborating with other agencies so that we can expand these hotlines, and we can also offer as much services to all of the regions in the country. Katulad din po nung sinasabi kanina ni Presi at saka ni Dr. Ragia and Dr. Argamosa, yung training po, napaka-importante. No? I agree very much with Presi when she said na ang kailangan po natin ngayon ay community health services. Let us not confine the program for mental health dito po sa higher level facilities kasi mas hindi po ma-access ng ating kababayan. Kaya po napaka-importante ng primary healthcare approach dito po sa ating mental health services so that it will be easily accessible para po sa ating mga kababayan. And of course, meron po tayong on the ground na expertise dyan pagdating sa komunidad. Kilala ho natin yung mga kasama natin dyan sa ating community. Mas mabilis po tayo nagkakaroon ng communication line with our citizens or constituents kapag nagkaroon tayo ng community-based services. This would also be able to rationalize the program for mental health. Dahil makikita na ho natin, we can be able to navigate patients kung saan po talaga yung appropriate, kung saan sila dapat magpatingin. Dapat ba ay sa komunidad lang at namomonitor lang ng ating local health offices o dapat ba higher facility na po ang gagamot sa kanila. Lahat po ito ay pinagtatrabahuhan ngayon ng ating national government through DOH and of course with our partner agencies and the National Center for Mental Health. So sana po tayo po ay magtulong-tulong. Kailangan po namin ang tulong ng ating mga local units para po magpatupad ng maayos nitong ating mental health program. Lagi niyo pong tatanungin ang inyong mga kasama sa trabaho, ang inyong pong mga kapamilya, ang inyong pong mga kapitbahay kung hanggang sa ngayon, okay pa po ba kayo? Dahil lagi po natin tatandaan, it's okay not to be okay sa ganito pong sitwasyon natin na meron tayo ngayon. Kahit po kami dito sa national government, and I think even Dr. Bernard, no, sabi niya kanina, ilang gabi siyang hindi nakakatulog, no, for the past year because of all of this work that we have to do. Pero kailangan okay po tayo lahat dahil kailangan magbigay ng serbisyo. Pero minsan po dadating tayo sa punto na hindi na tayo okay at hindi po yun nakakahiya at hindi po tayo kailangan na magtago ng ating nararamdaman. It's okay not to be okay, especially in this kind of situations. We have services being offered para po tayo ay maging okay at may makausap tayo. Lagi po natin tatandaan, hindi lang po pisikal na kalusugan ang ating dapat siguraduhin, kung hindi pati din po ang ating mental health ay dapat masiguro natin at ma-ensure natin na lahat po ng ating mga kamag-anak, mga kasama sa community and even our neighbors, no, ay maayos po ang ating mental health. So sa lahat po sa inyo, gusto po namin magpasalamat uli at sana po tulong-tulong po tayo para maging maayos na po itong ating mental health services, ma-access ng ating mga kababayan, at para po maging rational na ang programang ipapatupad natin simula po sa taon na ito hanggang sa mga susunod. So thank you very much and good afternoon to all of you.
Maraming salamat po, Yusek, for your closing remarks. Kagaya nga po ng sabi na ating Secretary of Health, mental health is a major public health concern that needs to be openly discussed and addressed. Kung sa tingin niyo po o kayo o ang inyong mga kapamilya ay nakakaranas ng depression, stress, or anxiety, huwag po tayo mag-hesitate na tumawag sa National Center for Mental Health dahil makakatulong po sila sa inyo. Again, maraming salamat po to our panel. Mag-ingat po tayong lahat at magandang hapon po. Maraming salamat po.
Maraming salamat.
Thank you po.